Hello, my name is Michael Keating. I'm a pediatric urologist in Orlando. I work with the Walt Disney Pavilion, Florida Hospital for Children. I have an office at Princeton Avenue at 615 East Princeton, next to the Science Center. I have a younger colleague, Pablo Gomez, who's also a pediatric urologist, joined us recently from Boston Children's Hospital and has a similar interest in our topic today, which is toilet training in children, lessons learned. This is our office on a typical day. You can see the children are lined up. Parents are concerned about the fact that they're not yet toilet trained and are still wet and wearing diapers. So what we're going to do is try to answer some of your questions today with regards to toilet training in children. And we will get to the bottom of this. Now, I'm not a neurosurgeon. This slide shows the variety of interplays between the brain, spinal cord, bladder, and the sphincter that help to control a child's bladder. Simply put, however, what we ask the bladder to do is a very complex constellation of functions. We ask the bladder to hold on with our sphincter muscles. The bladder holds on. If it feels full but we can't find a bathroom, we hold on further. Then we open up our sphincter and then we go. And we should go to completion over time. That's a fairly complex interplay of brain, bladder, sphincter, and the nerves to those areas. This slide shows the developmental milestones that are seen in children. The first thing that children learn to control when they're little is their bowels during the daytime. Secondly is the bowels at nighttime. Third is daytime urinary control, and last of all is nighttime wetting. We're not going to focus on nighttime wetting today, but we may save that for a later date. This slide shows the developmental milestones that are seen in children with urinary control. What happens in babies and newborns is that they have reflex voiding. Their sphincter muscle holds on, their bladders are small. As soon as their bladders get to a certain level, the sphincter muscle opens and they go, and they often go to completion. As a child's being toilet trained, they learn how to control their sphincters. The problem is a lot of times there's some miscoordination between how the bladder is working and how the sphincter is opening. It's a condition called dyssynergy. And over time, as a child learns they get bigger, the bladder gets bigger, the frequency goes down as the brain learns to inhibit the bladder, because that's what your brain does as you become toilet trained. And by about 3 or 4 years of age in most children, they'll have a normal adult type pattern where again they have reflex voiding, but they can control it. So instead of the bladder going all the time like it might in a smaller child, the bladder holds more and the brain inhibits the contractions, and then the sphincter opens and we go to completion. Hopefully we go all the way. This slide shows voiding patterns and the changes in development. So on the first slide, what it shows is that there is in a newborn, the sphincter opens and the bladder fills, and when it'll empty to completion. In the second slide, the problem is that the sphincter often will fight the bladder, and that's where kids start to have discomfort, for example, or they'll go in small amounts. In a normal person or a normal newborn, the bladder fills. You'll hear this as the sphincter opens. Like water down a drain. As a child goes through toilet training, you'll often hear this kind of pattern, because they're not relaxing their sphincters very effectively. Or you might hear this in an older child who's in a hurry. Just enough, they're just going off the top and they're going all the time. That's where kids get into trouble, for example. In an adult, hopefully you out there, the parents, you'll hear a pattern similar to the first one I just described. Now, there are cultural differences in toilet training. There's a tribe in Africa where the children are generally toilet trained between 4 and 6 months of age and totally toilet trained. And when those tribes have been studied, there's a very close and constant interplay between the mother and the child. Okay, and that's something that obviously most of us in America don't have that much time to do. In Asia, in some of the countries, what they do is as soon as the child looks like they're starting to show a generation of an abdominal pressure, like they're going to go have a peep or a poop, they'll put them on the toilet and try to train them that way. And the point is that you can train children if you try at an early age. The question is it really that necessary, or in our country, is it really that easy to do, which it's not. At the bottom you can see we're in a daycare, and unfortunately a lot of times the toilet training is left to the daycare providers. They have a little bit of vested interest because obviously it's easier for them to have the child into underwear than it would be to have them into diapers. So the question is, when is your child ready? There are two questions: when is the child ready and when are you ready? Well, the child is ready when they show some physiologic maturity, and there you would see a pattern where they're starting to be able to hold onto their bowels for maybe an hour or two, a couple hours, and maybe even holding onto their potty, sometimes longer durations at night. They show some developmental skills. They're able to converse with you. They may pull on their diapers. They're showing that they're feeling the sensation. They're able to get into a little potty chair if you've had one available. And finally, behavioral maturity. Are they even interested in this at all? And every child's different, and it's a spectrum. Little kids are like puppies, okay? You're the master, you're their world, they want to please you. So you can break children pretty easily if you try hard, just like the tribes do in Africa or the Asians do in certain countries. But the question is, should you really do it at an early age? The easy part of toilet training is holding on for your parents. The hard part is letting go. And so we do have problems, we think, in children that are toilet trained prematurely and asked to hold on at an early age when perhaps their bladders aren't ready. Now, they have done studies, and they've looked at children that have been trained at the various ages I've suggested, and the important thing is that it's not done in an adversarial setting. So as long as you make it positive, most kids that are toilet trained, regardless of the age, will tend to do well. But as a parent, the important thing is not to get frustrated, and you really need to bring a lot of patience to the table. Now, in this slide, it shows different ways that you can reward a child. You get them the little scooter toilet. You can put colored pads on the toilets. You can even have a computerized toilet training machine that they have now. The next slide shows something called the doodah chair, which plays music when the child goes to the bathroom, and all that's quite cute. But if your child's not ready, don't get frustrated. They all get it. We've never had a president in diapers, okay? And toilet training is not the sign of intelligence. And I know that there's a lot of comparison that goes on among parents, and somebody that's toilet trained their child at 18 months of age and they were able to do it in a day, they think they have Albert Einstein on their hands. Well, guess what? That's not actually the case. And the other thing is, are you as a parent ready to go through the toilet training, because it takes some time? When will you be ready as a parent? Well, you want to avoid comparisons with other parents. Okay, nobody remembers who was in diapers for a few more months. It's not that big of a deal. Anticipate accidents. Okay, this is like every other part of development. When the child learns to run, they fall. And when the child learns to toilet train, there will be accidents. Some kids will do well for a little while and then they'll backslide a little bit. That's not a reason to pull out your hair and get frustrated. And finally, positive reinforcement. There is no room for punishment in toilet training a child. This slide shows the percentages of toilet training among American children at various ages. At the age of 2, about 25 to 30% of children are fully toilet trained. By 2.5, it goes up significantly to 75 to 80%, and finally by 3 years of age, most kids are toilet trained. Now, there's some children that aren't ready at 3 years of age, and it's all right, they'll get it. The child usually gets it at the later ages once they look around and they realize that they are the only child wearing diapers. So, what is the rush? Well, there's no rush at all. And there's a book that's been written, Toilet Training in Less Than a Day. Okay, if you're able to do that, all the power to you. I think it takes some time, and again, practice patience. It's probably not an urban legend that boys do take longer than girls. The slide shows a little girl examining her brother, and little boys' bladders are different. They've been shown to be smaller at times, tend to be high-toned, go off unexpectedly more often than little girls. So little boys do take a little longer than little girls. The other thing about siblings is that children with siblings tend to kind of follow along and emulate their older brothers and sisters. So if you've got other kids in the family, you have to take that into account, that your child may magically toilet train themselves as they're brought along by the sibling. I know you want to get the child out of diapers, but again, there's no rush. So how do you start toilet training? Number one, it's good to have a vocabulary worked out with your child about their potty, their poopy, and what the name you give the toilet. Then if you feel your child's ready, go out and buy a potty chair, okay? One that the child can get into with ease. And you should practice sitting in the chair initially while clothed. These recommendations, by the way, are not my own. They've been excerpted from Dr. Barry Brazelton, who was very positively inclined about toilet training. Historically in the United States, toilet training was done with some rigidity and punishment. And again, that's really not the way to go. The reason for practicing with your clothes on is it's like a rehearsal, and it gets a child at ease with just sitting on the toilet. The next thing to do is to practice without diapers and seeing how the child does. Finally, in order to coordinate it with the actual bowel movement or the urine, you can pick out assigned times. So for example, a lot of kids, when they're getting ready to take their bath, the water and the running of the water will send a signal to the brain that gets them ready to void. Other children, we have a reflux. After we eat our dinner, for example, it sends a signal to our colons that says, my stomach's full, I'm ready to have a bowel movement. So after dinner, maybe 20, 30 minutes later is not a bad time to sit your child on the toilet and have perhaps a bowel movement. And finally, you want to go through a transition to pull-ups or underwear, and you can use the underwear as a reward. You know, being wet at an older age is really a problem, and if the child is getting frustrated with your attempts and their own in being toilet trained, they perhaps need to see a physician like myself. This slide shows a little girl who's doing the pee-pee dance, known medically as Vincent's curtsy, and what you see is that she's squatting on her heel. What's happening here is this is the busy girl syndrome, often called the busy boy syndrome. Her bladder wants to go and she's saying don't go. Okay, her bladder may be smaller than it should be for her age. Her bladder may be affected by her bowels. If this is your bladder and you've got a big bowel movement behind it, look at your bladder. You don't have any volume. You've got to go a lot, okay? So what this child's doing is trying to suppress the bladder contraction and providing it some additional sphincter control. The trouble in little girls is it is just a short distance for bacteria to get into their bladders, and that's why if they don't go to the bathroom on a regular basis and take their time, they're going to get infections. So that's why it's important for little girls, once they're toilet trained, that they are directed to the bathroom on a regular basis, told to get their legs widely spread so that their muscles can relax and attempt to get all their urine out. If you go to zero and empty all the way, you will not get infections. And so one of my caveats in toilet training is that an empty bladder means a happy bladder. Now you have to be careful about bowel patterns. The American diet tends to run constipating, okay? If your child's like my kids were, they like macaroni and cheese and white rice and noodles and bread, and that's all been put through a processor. It doesn't give your colon anything to work on, okay? And you can be faked out. Your child can poop every day and be constipated. Their colons can be all backed up with stool, and they're going every day, but just enough to take the signal away. So going every day and being daily and regular may not be going efficiently. And again, the problem is that this is your bladder. The bowel movement can make the bladder smaller. It can push the bladder up so the urine can't get out. And where do you think all the bugs come from that cause infections? They come from the rectum and they go right into the bladder. So my second caveat is that an empty rectum means an even happier bladder. A lot of my kids will have a honeymoon period in toilet training. They're doing really well for a while, and then all of a sudden they start to have problems, and that's usually oftentimes caused by constipation. The first thing that kids learn to hold on to, again, is their bowel movements. You have to be careful once you initiate toilet training that you've identified the foods that get through the little kitty and keep the bowel movements going. Because, you know, if you're a 2-year-old and your bowel movement is as big as your parents and it stretches your bottom, guess what you think you tell the next one? Don't come because you're killing me. But if there are problems and concerns, you need to make sure that the child's been examined and evaluated by initially your pediatrician and, if need be, a pediatric urologist. So, we like all our kitties to be dry, but a lot of them aren't, especially at night. Now, nighttime will be another discussion for a different time, but it's understandable that a child that's maybe having trouble in the day, you know they're going to have trouble at night. So when we evaluate bedwetters here, a lot of parents come here initially because of the bedwetting problem. Understandably, the sheets are wet, you know, and it's a frustrating problem for the child and for the parent. But when we look at those kids critically, a big portion of them have underlying daytime issues. For example, if you're a holding on type of a child and your bladder's sitting there going, hey, I want to go, and the child doesn't want to go, that bladder is doing isometric exercises. It's going to get high toned. So you know they're not going to be able to control at night when they're sound asleep, especially if they're deep sleepers. Same thing with the bowel movements. If your bowel movement is impinging on your bladder and you don't have as much volume, well, you can control that during the day when you're awake, but when at night when you're snoozing, guess what? You're gonna wet the bed. So a lot of bedwetters, once you buff up the bowels, bedwetting gets better. The prevalence of bedwetting is very common. So at 3 years of age, when those kids are toilet trained during the day, still about half of them bedwet at night. Don't get frustrated, it will gradually mature. Usually as a child gets to be about 7 or 8 and social pressures come to bear, and about 10% of the kids are still bedwetting, that's when it might be reasonable to have them evaluated by a pediatric urologist. We're fortunate to have a nurse practitioner in our office, Penny Noto, who is a doctorate of nursing whose area of expertise is wetting. Well, that's about all I have to say about toilet training. Again, practice patience, love your child, they will all get it, and in case you get frustrated, we'll be here to help.